Good afternoon. I'm Roger Mackey, Mayor of the City of Cloquet. Thank you for watching on the live streaming that we're doing, and thank you to the media members who are here as well. I want to thank people in our community who are really stepping up and doing all kinds of things to help during these difficult times that we're facing. I want to thank the speakers who are here today for making themselves available to speak to the community and keep us up to date. I want to thank the public for their efforts in following the governor's stay-at-home order and doing things like social distancing and washing hands and so on. And also thanking public for the donations and neighborly help. Cloquet has a strong sense of community, and it's been showing very much during these difficult times. We have some things from the City of Cloquet that are temporary service measures that I want to run through first. In response to the evolving conditions of the COVID-19 outbreak, the declaration of local, state, and national emergencies relating to it, and the City of Cloquet's desire to maintain a safe workplace and encourage and adopt practices protecting the health of employees, customers, and the public, while also ensuring the continuation of city operations during this pandemic. The City of Cloquet has implemented several temporary service measures. Although the city continues to provide all essential community services, public access to all of our facilities was suspended beginning Wednesday, March 18th. Beginning today, March 30th, 2020, many city employees have been working from alternate work sites to help reduce and prevent the spread of the virus. Please know that you can still reach staff via email and phone. All contact information is listed on the city's website. During this time, City Council meetings will be conducted by video conferencing. However, we strongly encourage our citizens to watch the meetings, which we streamed live on the city's website at www.cloquetmn.gov. The public will not be able to meet in the council chambers. However, the city will be providing opportunity for the community to ask questions prior to and during the council meetings. Instructions for providing public comment during a council meeting will be posted on the city's webpage. City maintenance staff will continue responding to emergency situations such as snow removal, sewer backups, and water leaks. During the pandemic, the city will suspend all disconnections for residential customers, and penalties are suspended at this time. Utility payments will continue to be received by mail, online, and by phone. City staff continues to process all types of permits and license applications online, by fax, or by email. For those who have business or residential economic development loans that need assistance, the city has prepared deferral options. We ask that you contact staff regarding financial relief due to COVID-19 to discuss options. For those who are sheltering in place, I want to note that the Cloquet Library continues to offer an extensive collection of online services, including ebooks, e-audiobooks, downloadable magazines that patrons can access online at www.cloquetlibrary.org. A full description of city services during this period is provided on the City of Cloquet website, and as the city continues to develop additional information, we will make it available at www.cloquetmn.gov. And with that, I'd like to move into the next part of our program, and some of our speakers. Our first speaker is Dr. Charles Kendall, who's affiliated with Cloquet Community Memorial Hospital, and I'll turn it over to Dr. Kendall.
Yeah, I'm Dr. Charles Kendall. I'm a family physician, one of the members of the new combined CMH Rader Family Clinic. I'm also a hospitalist working in Cloquet Hospital, and I'm currently the director of medicine. But I've taken on heading up our organization's response to the COVID outbreak. And we've had a group of key people from various departments in the hospital meeting for the last few weeks to try to plan and get ready for this infection when it hits our community. You may have already seen some of the effects of what we've been doing, the changes we've been making at our facility. For one, we're not doing any non-essential surgeries at our facility for the last couple of weeks. In fact, we had made that decision in our surgical department prior to the governor issuing his order saying that there should be no non-essential surgeries done. We've cut back the patients that we're seeing in our family medicine and specialty clinics to just those that really need to be seen. We are looking at and have started with some e-visits, as they call them, and we're trying to get set up to do telehealth so that our family doctors and our specialty doctors can continue to provide care for our patients during this time when we don't want them coming into the clinic and exposing themselves to infection or exposing our staff to infection. We've also instituted screening of everyone that walks into the clinic and the hospital. Anyone who comes in now is screened by someone at the front door who will ask them questions about whether they may have a fever or a cough or signs of infection or whether they have traveled anywhere. And they will then hand out a mask to those people if appropriate and direct them to where they may need to go. We also, though, if they should answer yes to some of the screening questions and we are concerned they could be a potential COVID case, we have a nurse triage line set up in our emergency room that will then further screen the person with more questions and determine if we need to bring them to a spot that we have set up, a door specifically for doing further evaluation of possible COVID cases. There, on our end, we'll actually see them and take vitals and get more history from them, consult with one of our ER physicians if need be, and determine if this person may be at significant risk for COVID. If they are, but they're not sick enough to come in and have to be evaluated further or to be hospitalized, then we will give them precautions for themselves, their family members, their household contacts, and have them go home. At this point, we're unable to test those people. Of course, if they look like they need to be evaluated further, they're brought into the emergency room and we take a look at them and take it from there. We also have instituted employee screenings. All employees, as they come to work, now get their temperature checked. And they report any symptoms they may have to their direct supervisor to determine if maybe they shouldn't be coming to work, if they need to go home or be evaluated further. We've limited our visitors. Most of our visitors are limited to one visitor per patient that we have hospitalized. We also have one visitor limited to be there to support an OB patient when she's in labor. This is consistent with what they're doing in our area in a lot of places. Some places have gone to having no visitors, but we don't feel we need to go to that point yet. Elsewhere, we've put protocols in place, been looking at how we should respond in the various departments in the hospital. The ER has developed protocols for personal protection equipment for various scenarios in the ER, how they're going to handle different situations, who they're going to test for COVID. Same thing within the hospital, a number of protocols, especially for the nursing staff, and in doing what we call donning and doffing of their protective equipment in the right way to avoid mistakes and avoid getting infected themselves as they're caring for the patients. We've also been doing critical care planning in our intensive care unit, considering ventilator management should we have patients on ventilators. We've identified the people within our organization who can provide critical care, do ventilator management, all of those aspects of care we may be pressed into doing should this outbreak become as bad as we've heard about in other places in the country. We also have been struggling, like everyone has, with looking at our amount of supplies. We have enough right now, but we are woefully short should we get hit with COVID at our hospital like they are elsewhere. We are looking at finding new sources of supplies. There are some hopeful signs we may be able to get, but especially for the higher level masks, the ones we call N95 or respirators, we could use as many of those as we could get to help protect our employees as they provide care to these COVID patients. This is one place where the community has already kicked in and has been donating masks made at home. And that is great. We have not had to use those yet, and I really hope we don't get to that point. But we have them, and we've been talking about how we might utilize those masks because, of course, they're not medical masks, but they can provide protection. We may be protecting our N95 masks so we can keep reusing them more safely by covering them with a cloth mask every time we see a patient. So we appreciate those donations we've received from the community. We've also been looking at regional planning for our area, how we can provide the best care for anyone in our area, especially in the area of critical care. We've been in touch with the bigger hospitals in Duluth. We're starting to reach out to other facilities in our area to try to come up with a plan about how can we provide the best quality care as this infection gets here. We also are considering what are we going to do when the big surge comes? What are we going to do with staffing? How are we going to handle when at least a third of our staff is probably going to be off work because they're either sick or on quarantine because of exposures? Everybody at the hospital, all the departments have been working really hard to try to get everything in place to make sure we're able to provide the best care for our patients in this community. I mean, I can't say enough for people come up to me every day and volunteer to do more than is even part of their regular job duties. As far as testing, so far we've done a number of tests at our facility. We are limited to, at this point, testing only patients we hospitalize with respiratory illnesses. If we have a healthcare worker who has been sick or feverish, we can test them, though thankfully we have not as yet. Or people who are residents of nursing homes or assisted livings in our area, and we've tested a couple of those. Thankfully, so far, there have been no positive cases confirmed or identified in Carleton County. But we're not kidding ourselves. It is coming. It will be here soon. I hope that what has been put in place by our governor's actions and our local communities will have some effect on how fast that surge gets here and how it looks. We have all heard and read the stories about New York City and New Orleans and Italy and China. And I apologize if I get a little emotional, but we are all scared. Everyone in our community, everyone at our facility. This is a serious illness, and for 80% of you, it probably won't be. It'll be nothing, or a mild cold, or whatever. For a bigger percentage, for about maybe 20%, you're going to get sicker, and a small percentage will become critically ill. And unfortunately, a high percentage of healthcare workers will get this virus. And as we've all heard about, deaths of people around the world, they always talk about the doctors, but my concern's more for the nurses. I may spend 5 minutes with a patient, seeing them in the hospital each day. They spend their whole shift with that patient. And so I worry about, the health care of our nurses and of all of our staff. And with that, it makes me you don't want to put out a plea. The places that have gotten this virus under control have been doing two things. They've been testing a lot, and then they have been shutting down their communities, their people, having people stay home. Unfortunately, in this country, we can't test like we'd like to and really need to. We just don't have the tests. So we are left with, sheltering in place, shutting our schools and a lot of our businesses. And I hope it's going to have an effect and slow the surge. But I really want to, put out a plea that as hard as this guy has to be for everyone right now, especially those who currently aren't able to work because of this, please stay home. I had 3 different people who work at the hospital come up to me this weekend when I was working and say, yeah, I was at Walmart, and they're not following the directions. They're not listening to the governor. There were groups of people in Walmart, lots of people in Walmart, people with family and a bunch of kids in Walmart. And that's very concerning to me because that is really the thing that will stem the tide of this infection. So I ask everyone in this community to please step up and stay home and try to protect all of us in the community.
Thank you, Dr. Kendall.
Yeah.
The next speaker will be Rick Brewer. You should introduce yourself as well, Rick.
Thank you, Mayor. I'm Rick Brewer. I'm the CEO and Administrator at Community Memorial Hospital and Sunnyside Healthcare Center. Thank you to the city for hosting this event. We believe that educating the public is a good way of both truly educating, letting you know what we're doing, the steps we're taking, passing out information so that misinformation isn't what's going around, and also to hear from a variety of agencies so everyone knows how we're working together. Also, thanks to Dr. Kendall for coordinating, leading many of our preparation efforts. He has gone well above and beyond, and we have a whole team of people who've been working hard on this. The events that we are experiencing today, we have not seen in our lifetimes. We've drilled and practiced for a number of different things that could happen, but this is different than anything that we had prepared for. And I couldn't be prouder of the efforts that I've seen, people from our own facility, across our medical community, public health, our other local agencies, city and county-wide. There's really been a tremendous coming together, and I am very happy to be where I am, where I live, where I work. Starting out talking about that, I don't want to repeat too much of what Dr. Kendall talked about. I do want to emphasize that our employees are the most valuable asset and resource we have. So we are all about keeping them safe. We're also about keeping them protected financially. You've heard of some organizations, some healthcare organizations have begun layoffs. We are keeping everyone on board at this time. We believe we have a plan to make that work, and we think that's very important. Within a very short order of time, it's going to be all hands on deck. And we need to do all we can to stand behind those employees because we're going to be asking that of them very soon. Dr. Kendall spoke very well about the precautions we're taking to try to keep staff safe, and it honestly keeps patients safe at that time as well. He talked a bit about visitor restrictions. There are a couple of areas where we have tightened the restrictions even further. Our nursing home, which has our most vulnerable population, there are no visitors allowed there. And then within the emergency department, that is the same case as well. And all of these things are being constantly evaluated, so you could see further changes if circumstances warrant that. Dr. Kendall also talked about telehealth, e-health. We know it's important for people to still get the care that they need, and in the interest of trying to keep people safe, this was an effort that we had intended on working on during this year anyway. And because of these circumstances, we have very quickly moved to a new platform that actually just today we were trialing. Tomorrow it will be partially operational, and by Wednesday it will be fully live, where for physician visits, as well as various outpatient areas such as diabetic education, speech therapy, occupational therapy, people will be able to get their appointments done from a distance, from their own home. As we are ready to give out details of how people can connect for those appointments, we will be promoting that and sharing that through our website and Facebook and with the city and county public health as well. But if you call to make a regular appointment, you will also be given instructions on how you could interact with us that way. And we think that's one more way of still delivering care to folks during these times while keeping everyone as safe as possible. And then the planning that we are doing to expand our capacity, called surge planning. There is a lot of coordination going on across our community, county, regionally, and at the state level. We have been asked to look at and provide information about what we could do in the means of adding beds, adding critical care beds, adding what's called alternate care sites, both on-site within the hospital as well as community-based. We have the role in some of those settings, we would be leading those efforts. In some of those other settings, like community-based, we would be a part of those efforts, where the state actually would be kind of leading a lot of that. We're prepared to be a part of each of those teams. We are preparing for the worst and hoping for the best and expecting something in between. And so because of that, we're doing scenario planning that in all my years I never thought that we would be envisioning. But we would be prepared to stand up and house a great number of patients in our facility using a combination of our own staff and outside resources if that's what it came to. Because if it hits our region, it's going to hit our whole region. An outbreak could happen in the city of Cloquet, but it could happen anywhere in this region, and it would affect us all. And that's the most likely scenario for how we'll all start getting busy very soon. So we are prepared to deal with that. Every day that we don't see it buys us more time to get better prepared. We are taking this seriously. We will be ready as we can be when it comes. And I want to thank those community folks as well who have given, people who have called us asking how they can help. People who've just sent us cards saying that they're thinking about us. These are difficult times, and we all need to pitch in together. We've had some area businesses who have given spare products they had, who've given us N95 masks, sometimes hundreds of masks and other supplies. As I say, we have people who are ready to volunteer and help us out once we need them, and all of that really makes me feel, again, proud of our staff and proud of our community. I think those are probably the main highlights of the things we've got going on, and again, our efforts continue to evolve. We will we'll keep developing our plans as the situation goes, and if this grazes us and it is manageable, and people's efforts to stay at home and mitigate this make it more manageable, we will all be grateful for that. If we are in the eye of the storm, we will all hunker down and we will take care of patients and we will keep our staff safe, because that's what we need to do. So thank you again for the opportunity today.
Okay, thank you, Rick. Next up is Mr. Dave Lee.
Thank you, Mr. Mayor. My name is Dave Lee. I'm the Director of Public Health and Human Services for Carleton County. And I just want to talk a little bit about the role of Public Health and Human Services in the pandemic response. Public health has both internal and external responsibilities. I'll just list them briefly and then talk a little bit about what we're doing locally within Carleton County. We're responsible for the continuity of operations for service provision, keeping our workforce and our clients safe and healthy. Externally, working to coordinate resources and messaging with our community partners, and providing essential services to anyone in isolation who has specific requests for services, for essential services that cannot be fulfilled by families and friends. I'd like to really reiterate what some of both what Dr. Kendall had to say and what Rick had to say as far as the preparedness that has happened in this county. We learned a lot back in 2012 when the flood came through, and
we, as the speakers you see today, have been working together in different capacities for emergency preparedness for a number of years. Some of the folks that, some of the things that has brought to our agency are a number of people trained in incident command. We have also built out our telehealth network throughout Carleton County for both health services and for social services. We've been doing that for over the last 5 years. So how that has helped us during this pandemic is that we're able to provide services to our clients anywhere from maternal child visits to working, connecting with people in their homes with severe mental illnesses, child protection visits, and across the board, including our long-term care folks. And also, we've been able to set up off-site. A number of our staff are positioned to be able to operate fully in their positions outside of the office. So, although our building is open, the community services building is open for the public health and human services. We are encouraging, and thankfully to the public, most services are being accessed online. We're connecting via phone call and also through telepresence. So we're doing a lot of connection throughout the community regarding telehealth, and also when need be, we're taking precautionary measures when we have to do face-to-face visits. Some of the current activities, I know I mentioned communicating with our partners about supplies, community needs, and resource management. We are doing daily press releases, so if you have not been receiving those and you'd like those, we are sending those out daily, and also we're connecting with our Carleton County staff on a regular basis. We're working with our regional partners on the increasing needs for mental health services, and I'll come back to that in just a minute. And also connecting with long-term care facilities to support our healthcare coalition and with Minnesota Department of Health guidance. A couple of the things that we are concerned about and that we've already started to see some increases in. There, you will hear more and more about behavioral health or mental health response. You probably have seen it in your own lives that this is a tough time. Anxiety, depression, stress is going up. So we do want to make resources available for folks to be able to deal with the increasing mental health needs. We are concerned about how to support one another. We've seen, and law enforcement will probably be talking more about this, but I know in our sheriff's department we're starting to see an increase in domestic violence reports, and we are concerned about the potential increase for child protection cases. I guess just to kind of wind things up, there has been requests or questions about how do people help. Our website is going to be listing areas where people can assist the community. Blood donations, looking out for elderly neighbors, checking in with those folks. We'll have some guidance on the Carleton County website along with our previous press releases. And to reiterate again, if people are sick, please stay home. If you can manage things at home, that is great. As Dr. Kendall mentioned, 80% of the cases are mild. I can't emphasize enough the need to wash hands, keep your hands clean, not to touch your face, and cover your cough, practice social distancing. And one thing I'd like to also stress is try to keep your immune system as strong as possible. Manage your stress level as best you can and take care of yourself both physically and mentally as best you can. So with that, I'll turn it over to the next speaker.
Okay, thank you. I'll say while the next speaker is getting ready that I've had two neighbors call me, checking in on me being so old. I don't feel like my actual age, I think, but it's nice that the neighbors have called, offered to get things from the store for us and that sort of thing. So people are reaching out literally to neighbors, and that's a good thing. So with that, I'll turn it over to our superintendent of Cloquet Public Schools, Dr. Michael Carey.
Thank you. My name is Michael Carey. I'm the superintendent of Cloquet Public Schools. First, I'd like to thank the mayor and city staff for inviting our schools to be a part of this. We appreciate you giving us this opportunity to communicate with the public. Like this, I guess what I would start with saying is it was, I think, Sunday, May 15th. Woke up to a conference call with the governor and the commissioner of education, and they gave us something. They gave us essentially a directive that was unprecedented in the history of the state, which is to be prepared to educate 2,600 students without essentially direct face-to-face contact with those students within 2 weeks' time. We had school that Monday and Tuesday, and then they provided us with 8 days for preparation and planning for how we would work out serving those students. Interestingly, in the situation of Cloquet Public Schools, we had spring break last week, which meant we had 3 days with our teaching staff and other staff to prepare to be able to start delivering distance education tomorrow. And thankful to our staff who did an amazing job and came together to ensure that we will be ready to go starting Tuesday the 31st. That said, we also had to coordinate some other very important measures. One was making sure we were delivering food to students across the city during days when school was regularly scheduled. We were up and running within 2 days to provide food both at our sites with what we called grab-and-go lunches, where students could come get their lunch and leave with it to go elsewhere where they could practice social distancing but still be fed. And we also coordinated bus stops around the city where students could go to grab a lunch, and those will continue to operate through the period of distance learning that we're about to engage in. The other piece that we were able to start, and I'll talk about more briefly, was the child care for emergency workers. That started on Wednesday the 18th as well. We initially started providing child care to our Tier 1 emergency workers. Moving forward, we will continue to provide child care to our Tier 1 emergency workers and also our Tier 2 emergency workers as space permits. That said, we are urging our public to only make use of that child care if absolutely necessary. We, like everyone else, are trying to do our best to protect our workers and make sure that we're protecting their health and safety. And so while our schools are being called upon to provide that critical service to our community, we also want to ask those in our community that you really only use it when absolutely needed. And we will be there for you to provide that service. Going back to the distance learning portion, I think the piece that I want to make sure we emphasize is that this is new and uncharted territory for all of us. We intentionally designed this to start slowly. We understand that families and children are going to be under a great deal of stress and a great deal of duress as they acclimate to their new normal over the coming weeks. And so our intention was to provide an easy transition into this and to allow families to kind of acclimate and get comfortable with their new situation. That said, one of the things that I want to make sure that we get out, this message gets out to the community, is that we have excellent systems in the school for communicating to people who have given us accurate email addresses, accurate phone numbers, and who have access to internet. If we don't have one of those three pieces of information, it is very, very difficult for us to reach out and get into contact with families, especially when we don't see their children day to day. The children are often one of our main modes and mechanisms for communicating home with families, and we haven't had them since the planning portion started. So we would ask everybody in our community, if you happen to know people who have school-age children and you know that they don't have access to email or internet, that you have them call their school. We will have staff in our school to answer questions and help guide and direct families as we transition into this time. So we ask, please make sure that people know to call their school office where we can give them that guidance and direction. For everyone else, we've been able to communicate a great deal of information. We've sent out numerous plans and emails. To summarize, grades K through 4, kindergarten through 4th grade, will be engaging in distance learning via paper pencil. We're putting together packets that will go out weekly. We have a system for both pickup and delivery and for drop-off of the following week's work when students complete their work, so they have a place to turn it back in. All of that is detailed in the school, the elementary school's distance learning plans. Every parent should have received a copy via email, If parents did not receive a copy, we ask that they call the main school office so that we can communicate the important portions to them and send them a paper copy as soon as possible. For our secondary students, grades 5 through 12, we will be using distance learning digitally through Schoology and other means. So all of our students have devices. We are a one-to-one district. We have sent those devices home with our students. We did engage in a survey right before we sent students home to try to determine which families do and don't have access to broadband internet, and we're currently working on options to help support families who do not have broadband. So again, if you do not have broadband or you know of people who don't have broadband, we ask that you have them call their school, and we will work with them to do our best to try to provide them service. Again, for our secondary schools, parents should have received a distance learning plan from your school via email. If you have not received that, we again ask, reach out to your school office. All of our plans are also available on our websites. So the district has a plan that's a combination of all the building plans that's posted on our district website, and each of our building sites are posting their building plans. So parents can access the plans on the web as well. I want to echo, I think, what I've heard other people say. We have a wonderfully supportive community. We've had numerous people and businesses reach out to us and ask us how they can help. We appreciate that. I think that the best we can do currently as a community is just be patient with one another, communicate with one another clearly. Please know that if something isn't going to perfection, give us a call. We're here to help, and we will be there to support you, and we will make sure that we make it work in the end. So patience and solid communication, I think, are going to be key through this, and so far we've seen exactly those things. I think in ending, I'd just like to thank the staff of Cloquet Public Schools. They've done a wonderful job in preparing in a very short period of time, and we'll be doing much more over the coming weeks to improve upon those initial plans. And then also want to thank our community. They've been wonderfully supportive as we've kind of endeavored into this new phase of learning for all of our students. Thank you.
Next up is Derek Randall, Police Department.
Good evening. My name is Derek Randall, and I'm currently the Interim Chief of Police for your Cloquet Police Department. Thank you, Mayor, and all the other panelists that shared all of that information. Like Dr. Carey mentioned 2 weeks ago, we were also tasked with how we were going to respond to the COVID crisis. At that time, we came up with our response. We shared that information on our social media sites, also on the city webpage. Today I want to go over some of the highlights from those updates, and also because this is a quickly evolving crisis, our response to the crisis itself is changing rapidly. So for us, just to let the public know, the Cloquet Police Department is still here. We're still serving and responding to all of your calls. However, some of the methods on how we respond to those calls have changed. But essentially, if you have an emergency, nothing has changed. Call 911. Some people who are hesitant to call 911, they may not think that their needs or call for service is an emergency. The Carleton County Dispatch, who we are dispatched through, has a non-emergency number, which is 218-384-4185. I have some numbers and some emails in my address here, and those are all available on our website and our social media sites. So if you miss them, I'll make sure that they're available. For our non-emergency, non-violent crimes, they will be handled by telephone and or email. Those are specifically crimes where we do not have a suspect and the loss is $1,000 or less. Some of the rationale behind that came specifically from our department, and then as we started to collaborate with other law enforcement agencies, specifically the Carleton County Sheriff's Office, who I mentioned dispatches our officers, but also runs the Carleton County Jail. we needed to adapt and make sure that all of our policies and directives aligned with each other. One of the things that the jail does not want is bringing in or exposing potentially infected people into the jail who could otherwise be cited and respond to a court date at a later date. So we've been working heavily with the Sheriff's Office, also with the Fond du Lac Police Department, the Fire District, and the Carleton County Emergency Manager to make sure that we are all on the same page. Should some of our officers become ill or need to be quarantined, we do have cooperative agreements in place with our neighboring agencies to ensure that coverage will continue. The officers have been advised to practice social distancing, but obviously due to the nature of our job, that is not completely possible at all times. But for the public, if we need to respond to an address or to your house, and you see the officer is standing farther back than you would usually see them, it's due to that fact that they are also trying to protect themselves as best they can. We've created an online reporting form that is available on our city website, also on our Cloquet Police Department social media pages for those types of calls that do not necessitate a call for service or an in-person response. Some of the other changes in our department: we are suspending our community engagement activities. A lot of our community engagements were responses to the requests from our community or from the public, and since they have canceled theirs, it hasn't been that big of change for us. Our permits to purchase or acquire a firearm can now be done online and can be submitted to our records division by completing the form again on our websites and mailing that form via email to records@cloquetmn.gov. We also have a tip line where people can message our department or send anonymous tips through our Nixle reporting system. That can be done by sending the message tip followed by Cloquet PD and your message to 888-777, and an officer will respond to you. Because the DMV is closed, people that have expired tabs on their vehicles or expired driver's licenses, they will be advised of that if an officer comes in contact with you. The officers are aware that DMV is closed and will take that into account should they come across a vehicle that has expired tabs. We've been asked, and through the governor's order, there is a penalty associated with failing to follow that executive order. I believe it's arrest and up to a $1,000 fine. At this point, we're asking the community, like some of the other panelists mentioned, we're asking the community to abide by that on their own. To be honest, we have more important emergencies to respond to, and so if you're stopped for something else, you may be either informed or advised or reminded of the executive order by the governor that's in place, and the importance of flattening that COVID infection curve for all of us. Some of the issues that we are dealing with are the same as some of the other panelists mentioned. We are short on sanitizers and masks. We are hoping that in the next week here we will receive a shipment of those items to keep our officers safe. Our lobby is closed. However, there is a phone in the southwest corner of the police department building that if you pick that up, you will be automatically directed to the sheriff's dispatch, and they will be able to help you. If you need to contact our clerical staff, they can still be reached at 218-879-1247. And lastly, I just want to thank all of our officers also. This job, like a lot of the other departments here, we're on the front lines of this, and our officers have really exemplified that credo of service over self. And so for that, I thank them. And I also ask that the public continue to practice that social distancing, do everything that you can to help us minimize the effects of this virus. Thank you.
Thank you, Darrell. Mr. Kevin Schroeder, our Fire Chief of the Cloquet Area Fire District.
Thank you, Mr. Mayor. I'm Kevin Schroeder. I'm the District Fire Chief for the Cloquet Area Fire District. We're the fire and ambulance provider for the Cloquet area. We remain fully functional and operational at this point. All of our facilities are functioning at normal capacities. In fact, we've even increased some of our staffing in our volunteer areas and our rural areas. Our facilities are closed to the public at this time, but our phone system is operational and still being answered. And there's always 911 for emergencies. With that, we're always continuously asked to remind the public that if it's not a true emergency, when it's related to flu-like symptoms or this COVID epidemic, please make contact first with some of the public health hotlines or your local provider before automatically calling 911. If it is an emergency, dial 911 and we will be there. This incident is changing some of the way we respond. You will be receiving screening when you do call 911. You will be asked a series of questions related to COVID symptoms, whether the caller has them or if anyone else in the residence or building has them. Please take the time to answer those questions. They allow our staff the time to prepare prior to arrival at your emergency. You will see our employees wearing personal protective equipment, whether it be masks and eye protection or gowns or other types of protection, even when you don't think it might be necessary. And that's both for the protection of our employees and also your protection as a citizen. We are also coming into your home causing an exposure that would not have been there necessarily had you not called 911. So the protective equipment actually protects both of us. We're more than likely going to be just sending one person up to your door and evaluating your medical condition prior to the full ambulance crew coming in. Again, that allows us the time and the information to determine what level of protection we need. If the incident level gets to the point where our transport level increases, we will also be making transport decisions in coordination with our local healthcare facilities. What that means is we may do an on-site evaluation and then inform you that we will not be transporting you to a medical facility because you don't meet certain requirements. You will be given information on how to stay at home and shelter in place, self-care, and phone numbers for additional information. We have not reached that point yet, luckily, in this area, but that is in part of our contingency planning. If demand does increase, you may also see a slight delay in response to non-life-threatening incidents as our providers are taking care of immediate threats to life and health. Some of the more minor things, you may be waiting 5 or 10 minutes for an ambulance, where prior to that it was almost instantaneously. We do continue to plan for this increased activity. The fire district, along with most of the partners you've seen at this table, have long-standing relationships in local, state, and regional organizations. We've worked well together long prior to the 2012 flooding and very closely since then planning for the next incident. We are looking at potential workforce impacts. If we start to get paramedics or firefighters that drop out ill, how are we going to deal with that? So we are putting those plans into place. As everyone here has stated, our personal protective equipment inventories are precarious. We are stable for right now, but if this begins to extend into 1, 2, or even 3 months, our supplies are not sufficient to sustain that. We are working to obtain those on almost a full-time basis. We are also working to update our information dissemination. So we will be providing public information on our website and Facebook pages, but also our public education programs are working on distance delivery. One of our core public service deliveries is car seat installations for child passenger safety seats. That doesn't go away just because we have a shelter in place, order in place. There's still people who are required to drive, so we're working on ways to make sure that those seats are either installed properly or the information you need is there. We're also seeing over the last 2 weeks a pretty significant uptake in structure fires, home fires. So while you're home, please keep fires safe. We just passed daylight savings time, so make sure the batteries in your smoke and carbon monoxide detectors are good. And as you're home more, using more appliances, more energy and everything else, just remember to be fire safe. We're open, as I said, for contact if you have questions or need information. Our office number is 499-4258. We can catch our website at cloquetareaFireDistrict.com, or further information, we try to keep our Facebook page updated daily. So, thank you.
Okay, that ends the presentations, but I think most of the panelists are still here. I want to, if there are members of the media that have questions for any of the folks, maybe you can ask those questions. And see if we
ask the questions all for the speakers. I'll bring you the microphone if you want to sit at the same spot that you were just, that you presented from. I'll bring you the microphone.
I have a question for Dr. Randall, actually.
If you want to come back.
So is there any sort of, I guess, idea or theory behind the fact that white hasn't reached here yet, or is that just a matter of time and coincidence?
It's just a matter of time. I mean, if you look at the graphs from all over the world, there's a fairly predictable pattern of how it starts out a little bit and then slowly grows, and unfortunately often then surges and explodes in that area. My hope is that we're not just in our early phase, that what we are doing in this state and in our communities is slowing the surge, because that would allow the medical community to get ready and not be overwhelmed, such as you see in the news there in New York City or New Orleans or Italy, where they're just trying to survive in their hospitals and medical facilities. So that's my hope. I don't know. We may just be in the early days where it just hasn't ramped up yet.
And do you happen to know the number of tests you all have performed yet?
Off the top of my head, not exactly. It's not exactly. It's relative to other places. It's a handful, and you know, so far we've had none that have come back positive, thankfully.
Gotcha. But the message, at least from Duluth and Superior, have been that even though people have not been tested, do you still assume that it is in Carleton County, just not confirmed through a test?
We have to do that, yes. Because there has not been any confirmed cases, you know, we would hope that it's less likely it's in the community, and there's not a lot of asymptomatic community spread, but it's around here. You have to think that it's here. If we could test the outpatients, the ones we send home, perhaps we would have actually identified a positive case by now. But at least in our hospitalized patients and the couple of nursing home assisted living patients we have tested, they've all tested negative.
Gotcha. And perhaps this might be a question for Rick, but is the hospital working with hospitals, more busier hospitals in Duluth, to possibly take extra patients if they can't hold them anymore?
We've had preliminary discussions with that. In fact, I expect a call from one of the people directing one of the hospitals in Duluth later this afternoon, where we may come up with exactly that scenario where, you know, they have the pulmonary critical care specialist and extensive ICUs and a lot of ventilators, and we have a few, and maybe it would be best if our patients were served in their facility if they become critically ill. And I think that would be the best way. And then we could, in return, take some of their, less critically ill patients at our facility in exchange. That could be a possibility. And if the surge is not as bad as it has been elsewhere, that certainly can be possible. We are preparing for anything, though, with the fact that if it hits here and hard, every hospital is going to be doing everything they can to treat all of these patients. So we are getting our critical care and ventilator capabilities ready.
Gotcha. And about how many ventilators does the hospital have here?
We have 4 ventilators that we could put into use.
And how many available ICU rooms?
We have the potential for 8 ICU patients. Though, what they're doing in many hospitals is they're utilizing spaces within their hospitals for critically ill patients that they wouldn't typically have in those rooms. They just, try to bring in the equipment into those rooms to manage them, so.
Thank you.
Yep.
Do either Jamie, Jenna, do you?
I think I'm all right.
No, I'm good.
Okay. Do you want to wrap up then, Mayor?
It's going to be a wrap.
Yep.
Okay. Well, as mayor of the city of Cloquet, I take very seriously the health and well-being of our citizens, and that's why we're here today. If you had a chance to watch the whole thing, I know that you'll recognize that we have very dedicated community leaders that are doing everything they can to prepare for what we may have to face. And the city is here to be supportive. As I ran through some of the things earlier, I'm not going to repeat all of them, but we are available, even though City Hall is closed. We are still available to take calls, answer questions that you might have. And I want to close by thanking the community. For the most part, I think our people are taking this seriously. They certainly should. I'm sure we're always going to have some people that do not, but if the vast majority of people follow the advice of the medical community, I think it'll go a long way to making the disease, the illness, not be as bad as it would be if we weren't taking these steps. So we're buying time right now. It's a good thing. More equipment coming in that people need, and I just want to express my thanks to all the folks who were here today speaking, and to those of you watching, I hope that you learned something, and I know I did, and I appreciate your attention to what we had to say. So with that, I'll end this session. Thank you.